Hello students, let's continue our lecture on angina pectoris. Let's study about uses of nitrates. The first use of nitrates is treatment of angina pectoris. For acute attack of angina pectoris, nitrates are used for treatment. For acute attack of stable angina, variant angina and unstable angina, nitroglycerin by sublingual route is drug of choice. 0.5 milligram nitroglycerin tablet is given by sublingual route, and we can have 3 attempts of nitroglycerin tablet at 5-minute interval. The other drug which can be given in place of nitroglycerin is isosorbide dinitrate by sublingual route. Why sublingual route is preferred for nitroglycerin? By sublingual route, drug directly reaches blood vessel and thus has faster onset of action. By sublingual route, the other advantage is self-administration. By sublingual route, drug avoids first pass metabolism. Nitroglycerin has very high first pass metabolism, so it is not given orally. Now for acute prophylaxis of angina pectoris, nitroglycerin by sublingual route is drug of choice. Nitrates are also used for prophylaxis or long-term management of angina pectoris. Examples of nitrates which are used for prophylaxis or long-term management of angina pectoris are as follows. Isosorbide dinitrate, which is given orally. Nitroglycerin as transdermal patch. Isosorbide mononitrate, which is given orally, is drug of choice for prophylaxis or long-term management of angina pectoris. Pentaerythritol tetranitrate, which is given orally, is longest acting nitrate. Isosorbide mononitrate has no first pass metabolism and thus 100% bioavailability. The other use of nitrates is treatment of congestive heart failure. Intravenous nitroglycerin is given for treatment of acute congestive heart failure. Venodilation by nitrates decreases preload, while arteriolar dilation by continued therapy of nitrates decreases afterload. This provides improvement in left ventricular function and regression of pulmonary congestion. For chronic CHF treatment, drugs which are given orally are isosorbide dinitrate and hydralazine. Isosorbide dinitrate and hydralazine are given orally for treatment of chronic congestive heart failure. Next use of nitrates is treatment of hypertensive emergency. IV nitroglycerin is given for treatment of hypertensive emergency. IV nitroglycerin is also used for treatment of pulmonary edema. The other use of nitrates is treatment of achalasia cardia. Due to spasmolytic action, nitroglycerin sublingual taken before meal promptly relieves esophageal spasm. Nitroglycerin sublingual relaxes lower esophageal sphincter, and thus it is useful in treatment of eclampsia cardia. Next use of nitrates is treatment of biliary colic. As a spasmolytic, nitroglycerin sublingual can provide prompt relief from biliary colic. Nitroglycerin sublingual relaxes biliary sphincter, and thus it is useful in treatment of biliary colic. Next use of nitrates is treatment of cyanide poisoning. Cyanide poisoning. Drug of choice for treatment of cyanide poisoning is intravenous hydroxycobalamin. Hydroxycobalamin is a form of vitamin B12. Hydroxycobalamin binds with cyanide and forms cyanocobalamin. Cyanocobalamin gets excreted in urine. Smoke inhalation during fire accident. Treatment of smoke inhalation during fire accident is intravenous hydroxycobalamin because smoke contains hydrogen cyanide. Alternative treatment for cyanide poisoning is amyl nitrite inhalation or intravenous sodium nitrite along with intravenous sodium thiosulfate. Fe2 plus in hemoglobin gets converted to Fe3 plus in hemoglobin by amyl nitrite or intravenous sodium nitrite. Now Fe3 plus in hemoglobin is called methemoglobin. Methemoglobin has higher affinity for cyanide and it combines with cyanide and forms cyanomethemoglobin. Now cyanomethemoglobin is acted upon by intravenous sodium thiosulfate. Cyanomethemoglobin reacts with sodium thiosulfate and forms methemoglobin and sodium thiocyanate. Sodium thiocyanate gets excreted in urine. Side effects of nitrates. Most common side effect of nitrates is throbbing headache. Throbbing headache is due to venodilation of meningeal vein. Next side effect of nitrates is postural hypotension. Postural hypotension decreases by lying down. Reflex tachycardia as side effect rarely occurs. Next side effect is coronary spasm due to sudden withdrawal of nitrates. Tolerance to nitrates is another side effect of nitrates. Tolerance to nitrates. Clinically, on intermittent use of nitrates, no significant tolerance develops. But if nitrates are given orally or as transdermal patch or by intravenous infusion without nitrate free period, tolerance develops. Tolerance to nitrates. Nitrates are acted upon by aldehyde dehydrogenase and the process is known as denitration. Denitration helps to release nitric oxide. During denitration of nitrates, reactive oxygen is also produced. Reactive oxygen inhibits aldehyde dehydrogenase present in veins. Due to inhibition of aldehyde dehydrogenase, conversion of nitrates into nitric oxide will not occur, and that leads to accumulation of nitrates in body. So the result is tolerance. How to overcome the problem of tolerance? Nitrate free period is needed to overcome the problem of tolerance. 8 to 12 hours per day of nitrate free period is needed to overcome the problem of tolerance. To prevent tolerance, nitrate free period is provided by removing nitroglycerin patch at night and again applying in the morning. Now, what is 0-hour effect? It has been found that more than 12-hour gap may cause rebound angina in the morning before next patch is applied, and this is called 0-hour effect. Transdermal patch is highly useful to prevent nocturnal angina. Tolerance to nitrates. Tolerance to nitrates is also related to development of Monday disease. Monday disease is found in workers of bomb making factory. Workers in explosives or bomb making factory complain of headache on Monday and Tuesday. Nitroglycerin is the explosive used in bomb making, and the most common side effect of nitroglycerin is throbbing headache. So when the workers join duty on Monday, they are exposed to nitroglycerin and they complain of throbbing headache. So on Monday and Tuesday, they have headache. From Wednesday onwards, there is development of tolerance in the workers. So throbbing headache disappears by Friday. And on Saturday and Sunday, the workers have holiday. That means nitrate free period on Saturday and Sunday. So the workers lose tolerance. When the workers come on duty on Monday, they are again exposed to nitroglycerin and again they complain of headache. Hence the name Monday disease. Nitroglycerin side effect is throbbing headache, and throbbing headache is the most common side effect of nitroglycerin. Contraindications of nitrates. The first contraindication of nitrates is severe hypotension. Raised intracranial pressure is another contraindication of nitrates, as nitrates cause throbbing headache. So nitrates are contraindicated in patients having raised intracranial pressure. Third, do not give nitrates with phosphodiesterase inhibitor like sildenafil. Nitrates should not be given with phosphodiesterase inhibitors like sildenafil. Nitrates is acted upon by enzyme aldehyde dehydrogenase, and the process is known as denitration. So nitrates release nitric oxide due to denitration. Nitric oxide diffuses in adjacent smooth muscle cells of tunica media of blood vessel wall and stimulates guanylyl cyclase. Guanylyl cyclase stimulation helps in conversion of GTP into cyclic GMP. Cyclic GMP stimulates protein kinase G. Protein kinase G helps in dephosphorylation of myosin light chain. We know that phosphorylation of myosin light chain maintains contractility. So dephosphorylation of myosin light chain will cause relaxation of smooth muscle cells of tunica media of blood vessel wall. So relaxation of smooth muscle cells of tunica media of blood vessel wall result in vasodilation. So nitrates cause vasodilation and is therefore helpful in the treatment of angina pectoris. This is important. Mechanism of action of nitrate as vasodilator is important. So blood vessel wall. Blood vessel wall is composed of three layers. Tunica intima, that is the innermost layer, tunica media, that is the middle layer, and tunica adventitia, that is the outer layer. So tunica intima contains endothelial cells. Tunica media contains smooth muscle cells, and tunica adventitia contains collagen fibers. So smooth muscle cells are mainly present in tunica media, and contraction of smooth muscle cells of tunica media result in vasoconstriction. Contraction of smooth muscle cells of tunica media result in vasoconstriction, and relaxation of smooth muscle cells of tunica media result in vasodilation. So in case of angina pectoris, when we give nitrates, nitrates undergo denitration. It is acted upon by enzyme aldehyde dehydrogenase, and nitrates release nitric oxide. Now this nitric oxide diffuses in adjacent smooth muscle cells of tunica media of blood vessel wall and stimulates guanylyl cyclase. Guanylyl cyclase helps in conversion of GTP into cyclic GMP. Now this cyclic GMP stimulates protein kinase G. Protein kinase G helps in dephosphorylation of myosin light chain. Phosphorylation of myosin light chain maintains the contractility of smooth muscle cells. So dephosphorylation of myosin light chain will cause relaxation of smooth muscle cells of tunica media of blood vessel wall. So relaxation of smooth muscle cells of tunica media of blood vessel wall will result in vasodilation. So it is helpful in treatment of angina pectoris by vasodilation. So this is the main mechanism of action of nitrates as vasodilator. I have also shown in the diagram that is cyclic GMP. Cyclic GMP is metabolized by phosphodiesterase 5. Nitrates should not be given with phosphodiesterase 5 inhibitors like sildenafil or tadalafil. Sildenafil or tadalafil inhibit phosphodiesterase 5. Phosphodiesterase 5 is responsible for conversion of cyclic GMP into GMP. Due to blockage of conversion of cyclic GMP into GMP, there will be too much accumulation of cyclic GMP, and that will result in overstimulation of protein kinase G. That will cause excessive dephosphorylation of myosin light chain, resulting in excessive relaxation of smooth muscle cells of tunica media of blood vessel wall. That will cause excess vasodilation, resulting in massive reduction in blood pressure, causing severe hypotension and death. So patient will die due to severe hypotension. That's why nitrates should not be given with phosphodiesterase 5 inhibitors like sildenafil or tadalafil. We will continue our discussion on drugs acting on angina pectoris in our next lecture.